The Delta variant was first detected in India, where it began circulating around April. It is now present, according to the WHO, to varying degrees in at least 85 countries.
Delta is the most transmissible of the variants identified so far. Has been identified in at least 85 countries and is spreading rapidly among unvaccinated populations. As some countries ease public health and social measures, we're starting to see increases in transmission around the world.
In Europe, the Delta variant gained a foothold first in Britain, and it was able to quickly outpace the spread of other variants, and now comprises 95% of all sequenced cases there. To put the strength of Delta into context, it's thought to be up to 60% more contagious than Alpha, the variant first detected in Britain in November last year. And Alpha itself is more contagious than the strain responsible for the first wave of COVID-19. It's a pattern being seen around the world.
Similar to the situation in the UK, the Delta variant is currently the greatest threat in the US to our attempt to eliminate COVID-19.
A third of new cases in the U.S. last week were identified as the Delta variant, up from an average of 10% at the start of the month. Amid a rise in infections in Israel and with a strong vaccination campaign in place, the government has told residents to start wearing masks indoors once again. It's come as a bit of a shock.
It's quite scary because it seems like most of the vaccinations here already expired. And it already was the sense that in Israel everything is done, like COVID is behind us, but it seems it's not.
While several studies have shown that vaccines are slightly less effective against Delta, they're still judged to be reasonably effective, but only after the second dose. Delta is so contagious that experts say in order to contain it, more than 80% of a population should be inoculated. It's a difficult target to meet, even for nations with functional vaccination programs.
More cases means more hospitalizations, further stretching health workers and health systems, which increases the risk of death.
Something authorities in Australia's most populous state are keen to avoid. 5 million people are under lockdown in Greater Sydney as more than 100 cases of the Delta variant have been identified. It comes despite Australia's tough rules on new arrivals. New South Wales Health Minister summed up Delta by calling it a very formidable foe, adding, quote, "No matter what defensive steps we take, the virus just seems to understand how to counterattack."